Melissa. I'm just here to do a head-to-toe assessment. I'm a student nurse. Is that okay?
Yeah.
All right, perfect. Can you start by telling me your name and date of birth?
Melissa Reed, January 11th, 1994.
All right, perfect. Thank you, Melissa. Is there anything else that you prefer to be called?
No.
All right, great. I'm going to just start by doing a quick general assessment on you. It doesn't look like you're having any problems with airway, breathing, circulation. Your color is good. Doesn't look like you're drooping to one side or anything like that, so it's great. I'm just going to ask you a couple silly questions. Just bear with me. So you already told me that your name is Melissa Reed. Perfect. And can you tell me what this is, Melissa?
A watch.
Very good. And can you tell me where we are?
St. Elizabeth's.
Okay. Can you tell me what day of the week it is?
Wednesday.
What time of the year is it?
Summer.
Very good. And who's the President of the United States?
Trump.
Very good. And earlier I asked you about an object. Could you tell me what that object? Very good. And it doesn't look like you're in any pain. Are you having any pain today?
No.
Okay, perfect. So I'm going to go ahead and get started. Feel free to stop me if you have any questions along the way, okay? So first I'm going to just do a quick feel of your head. I'm not feeling any abnormal protuberances. Everything looks like it's intact. The scalp is clean. The hair is clean and intact. Next I'm just going to move on to your face. So your face doesn't look like it has any drooping, which is great. Your skin color is appropriate for ethnicity, which is very good. That's what we want to see. And I'm not noticing any lesions, which is good. Next, I'm just going to check your eyesight, okay? So what I want you to do is I want you to follow the tip of my pen with your eyes. Very good. I'm not noticing any abnormal movements, which is what we were looking for. And it looks like your pupils are equal and round. I'm just going to check if they're reactive to light, so I'm going to shine a light to the sides of your face, okay? Okay. There you go. All right. Very good. And so your pupils did retract down from about a 5 to a 4, which is very good. So next I'm going to check for your corneal light reflex. I'm going to shine a light right to the middle of your face, okay?
Mm-hmm.
Just look straight ahead at me. Right, corneal light reflex is symmetrical. Next, I want you to pay attention to the top of my pen again as I move it closer to your face. And accommodation did occur, which is good. So next, I'm just going to feel your ears, tragus, auricle, and the mastoid process. Very good. Can you open your mouth for me? Very good, and stick out your tongue. Good. Mucous membranes are pink and moist, which is perfect. They're intact. I didn't notice any dental caries, any dentures, anything like that. And can you stick your tongue out all the way? Just gonna check for tonsils. Looks like tonsils are there. Very good. So next I'm just gonna feel for your lymph nodes, okay? So I'm feeling for the occipital lymph nodes, the postauricular lymph nodes, the preauricular lymph nodes, parotid lymph nodes, the retropharyngeal lymph nodes, the submandibular lymph nodes, the submental lymph nodes, and then moving on to the posterior clavicular lymph nodes and the anterior clavicular lymph nodes. Next, the supraclavicular lymph nodes. And I'm not noticing any firmness, any swelling. Did you have any pain when I did that?
No.
All right, very good. Now can you shrug up on your shoulders? Okay, good. Next I'm just going to check your arms. Okay. Arms look good. They're intact. I'm not noticing any bruising. And the skin color is appropriate for ethnicity. Next I'm going to just feel your radial pulses. Radial pulses are palpable and equal. Can you squeeze my hands? Very good. And try to pull up on my hands. Very good. And next I'm just going to check your capillary refill. Capillary refill is less than 2 seconds on each side. Very good. So next I'm going to move to your chest. It doesn't look like you're using any of your accessory muscles. I don't notice any abnormalities in the shape of your chest, and it doesn't look like you're having any problems breathing. So I'm just going to feel for a respiratory expansion. Take a deep breath. Very good. Okay, next I'm just going to listen to your lung sounds, okay? So what I want you to do is take a breath every time I move my stethoscope. hearing bronchial sounds. And bronchiovesicular sounds bilaterally. Okay. Bronchiovesicular sounds bilaterally. And one more. Okay. And hearing vesicular sounds. Very good. I'm just going to hear on the side here. I'm hearing bronchiovesicular sounds bilaterally. One more. And hearing vesicular sounds bilaterally. Okay, next in the back. I'm hearing bronchiovesicular sounds. And bronchiovesicular sounds bilaterally. And vesicular sounds bilaterally. Very good. And vesicular sounds bilaterally. Okay, next I'm just going to take a look at your abdomen, okay? Oh, actually before I do that, I'm going to take a listen to your heart, okay? So I'm going to start with the diaphragm of my stethoscope and a couple of the locations in your heart. Okay. I'm hearing S2 louder than S1 at the aortic. S2 louder than S1 at the pulmonic. S1 and S2 are equal at the Erb's point. And S1 is louder than S2 at the tricuspid valve. No, sorry. Okay. And S1 is louder than S2 at the mitral valve. Okay, so next I'm going to just palpate your apical pulse. Very good, it's where it's supposed to be. I'm going to palpate your carotid arteries. Very good. Okay, now I'm going to have you lean forward and I'm going to listen to those points again with the bell of my stethoscope. And I'm listening for any bruits. At the aortic, pulmonic, Erb's point, tricuspid, and the mitral. Alright, very good. Now what I'm going to do is I'm going to auscultate your apical pulse while I feel for the carotid pulse, make sure that there's no pulse deficit. Alright, very good. Okay, so now I'm going to have you lean back a little bit. And I'm just going to inspect your abdomen. I'm not noticing any distension, any discoloration. It's normal for ethnicity. When was your last bowel movement?
This morning.
Very good. And have you had any problems passing gas?
No.
Okay. And what about urinary problems? Are you having any problem urinating? Okay. Actually, before we do this, I am going to have you lean forward. I'm going to check for any tenderness back here. Just let me know if you feel any pain.
Nope.
Okay, very good. I'll go ahead and lean back again. And I'm going to just auscultate in all four quadrants of your abdomen until I hear sounds of your intestines moving. Very good. Next, I'm going to use the bell of my stethoscope to listen to your abdominal arteries. So first I'm listening to the aortic. Next the renal, iliac, good, and the femoral. Okay, I'm not noticing any bruits, which is good, that's what we want. Next I'm just going to palpate your abdomen. Let me just know if you have any pain or anything, okay? No pain? Okay, very good. So next, moving on, I'm just going to take a look at your legs. Legs look good. The color is appropriate for ethnicity. And I'm just going to feel for your dorsalis pedis. They are palpable and equal bilaterally. Your posterior tibialis, which is palpable and equal bilaterally. Next, I'm just going to look for capillary refill on both your toes, and both toes are less than 2 seconds. And I'm going to just check for your reflexes on your knees. Just use the back of my stethoscope. All right, 1, 2, 3. Thank you, very good. And 1, 2, 3. Very good. Okay. Now I want you to just pull up on my arms. Very good. Muscle strength is good. Perfect. Okay, you look like you're in good shape. Do you have any questions for me? Okay, awesome. Well, thank you so much, Melissa.
Thank you.
We'll talk about your headache in a moment.
Okay.